have on your mental health tonight the impact of infertility. A new report from the World Health Organization says it now affects 1 in 6 people worldwide. Here to answer questions is Dr. Manuel Pacheco, a psychiatrist at Tufts Medical Center. Thank you for joining us tonight.
Hey, Dr. Pacheco, it's always great to see you. So the WHO calls this new statistic staggering. And again, we'll repeat it for you. 1 in 6, right? Is that what we're talking about? 1 in 6. But if infertility is so common, why do some couples say that they're reluctant to talk about it?
Well, Ed, infertility is a very common, sensitive, private, and intimate issue that people are just embarrassed discussing with other people. However, if you talk about it with close friends or family members, people are frequently surprised at how many other people are dealing with the same issues. And there's a lot of support that can be found out there when you do share with trusted people, people that are going through the same thing. And it's quite comforting and can markedly decrease your sense of isolation about it. So I really want to encourage people to share that with some people. And a lot of couples that I've talked to have really found a lot of support, and it decreases the isolation, because sometimes you feel like you're the only ones dealing with it and you're not.
Right.
Absolutely. And as you know, those negative feelings can trigger more serious conditions such as anxiety and depression. Are there antidepressants that you can safely prescribe to people who are trying to conceive?
Well, Shayna, this is one of the most frequent questions that I've been asked when I see people on the medical and surgical units is what's safe during pregnancy and conception and when you're breastfeeding. And so people are understandably very reluctant to take anything that's unnecessary during these periods because they don't want to harm the baby or decrease their chances of getting pregnant. However, this is kind of a conversation that really has to happen with their obstetrician, gynecologist, or their primary care provider. There are medications, some are safe and some are safer, that can be used, and that's an important thing to talk about. It's also important to talk about other alternative things that you can use to help with anxiety and depression, such as things like acupuncture and meditation. And the whole point is that these conversations have to be an ongoing process with the people that are taking care of you, because you don't want to take anything away from you that could help you during this exciting and stressful time.
You know, Dr. Pacheco, that some infertility treatments can take years. It doesn't happen like overnight. It can take years. They can cost a lot of money. So that can be really hard in a relationship. So what do you want couples to know about coping with the strain?
So again, it's really important to talk about what resources are available in your area with your primary care people or your OB/GYN doctors, things like support groups and otherwise. One of the positive aspects, Ed, about the pandemic is that support groups have become virtual, whereas before, if you couldn't make it to the place physically where people were having the groups, it wasn't available. And there is a website that I do want to mention to people. It's called Resolve New England, resolvenewengland.org. And it is a big resource that talks about financial assistance, other support groups, other things that you can make available to you. And so between a website like that and talking to your primary care or your OB/GYN providers, it's important to make sure that you're taking advantage of all the resources that are available to you, because it's just, you don't want to take that out of your hands and when you're helping to deal with this stressful situation.
Right. ResolveNewEngland.org. Dr. Pacheco, it's always great to see you. Thanks for your time.
All right.